Welcome to Home Care, Doors Open, where we discuss licensing, operations, and scaling your home care business. Whether you're just opening your doors or looking to unlock new doors to growth and success, this podcast is for you. Let's begin.
All right, hello everybody. This is Lucas Carroll from the Business of Senior Care, and we're back again with another podcast for Home Care Doors Open, where we talk to our audience for people in the home care and home health space. And super excited today. We have a wonderful guest. Monique Robinson is the president of ABC Private Nursing, coming from the Always Best Care franchise. And I'm so happy to have you on today. Welcome, Monique.
Thank you so much. Happy to be here.
A lot of topics that I want to get into today, that you are implementing and driving at your company. Your office, your franchise for Always Best Care serves the greater Boston area, and you guys have been. Tell us a little bit about how long you guys have been in business, and anything unique about your franchise area.
Absolutely. So we've been in business since 2009. We're a franchisee. There's only one other Always Best Care franchise in the state of Massachusetts. We are exclusively a private pay home care agency, and we've grown our franchisee location over the past 15 years exponentially. So we hit a pretty broad market within uh, the Boston downtown proper area, along with the surrounding suburbs. We've grown exponentially over time just within our caregiver base and our aides base, as well as our clients. And we currently have over 500 caregivers that are employed with us per diem, as well as over 100 clients that we serve anywhere from an hourly basis to 24/7 care. Part of our home care franchisee, we offer anything from personal care all the way to companionship. And we are now looking at adding in a new division, which I am leading, which is private nursing. So soon we'll be able to offer skilled care in addition to the non-medical side of our business.
Yes, absolutely. And super exciting, for your office. I think just knowing for our audience to know the foundation of uh, growing in a big home care agency that has provided, wonderful service to the seniors in the greater Boston area over many, many years. And now looking to add another service line to the seniors and looking to move into private nursing, which is your role. Can you tell us a little bit about like what some of the motivating factors for you of looking at adding a private duty nursing or private nursing where you provide medical type care to the company, and kind of how that came to be?
Yeah, absolutely. I think there was an existing demand that we started to notice amongst our client base. Majority of the people we serve are elderly. A lot of them are excited about aging in place, but when you think about aging in place, there's a lot of factors that come into it, like socioeconomic status, your clinical status, and there's a lot of factors that can stop people from wanting to properly age in place, especially when they're dealing with comorbidities and all the health issues that present when you get older. And we saw a need, within our existing client base of okay, we're providing personal care, we're providing companionship, transportation, medication reminders, all of the non-medical things, but there's still a gap because they need skilled care, whether that's maybe wound care, maybe they need a nurse to educate them on their medication regimen. Maybe they need someone to help with their insulin. Maybe they're recently diagnosed with diabetes or some sort of chronic disease that they don't really have the resources themselves to handle on their own. So we saw this great opportunity for us to come in and really be that one-stop shop for them, beyond non-medical care. So, and we analyzed our market in terms of we're in a specific type of environment in Boston. Being one of the top leaders in care, we have some of the best hospitals, not only in the country, but in the world. We wanted to maximize on that opportunity. So we have so many people flying in to receive care from Mass General, Brigham and Women's, Beth Israel, some of these downtown renowned hospitals. And they want to be able to go home and recover in the comfort of their own home or maybe at a hotel, and then they can fly back home to wherever they're coming back from. So I think it was a mix of wanting to provide that like all-in-one encompass solution to our existing clients, as well as analyzing kind of our territory of being such a leader in medical care. Being in Boston, there's a lot of opportunity for us to capitalize on private duty nursing. So
Awesome. And you and your team have started the implementation process, and we were lucky enough to partner with you to help to just provide some support in growing and adding this service line. What can you tell us a little bit about? You had the idea for seeing a need
mhm.
for private nursing in the community, and then taking that to actually creating a program that can deliver this service for private nursing. What did that look like from idea to actually getting it to into action?
Yeah. So we started asking like a few kind of profound questions about, where we're at within the marketplace and if we can even start to entertain this idea of opening up a new private duty service line. And I think we wanted to, number one, look at our competition. Is there a lot of private duty nursing agencies in our area? Would we be able to run up against our competition? Or is there some like main players? And we really analyzed kind of from an agency perspective. There wasn't a ton of private duty nursing agencies in our area. There's a couple of like key dominant ones, but there was entry for us to even start to get into that marketplace, which was good. There was a window for us. Home care on the other end too. There's so many home care agencies in our area, pretty much in every major city, but we noticed there wasn't a lot of private duty nursing agencies. We wanted to look at the income level of our area as well. Are we in an affluent area where people can afford the private pay model? And we were. We were noticing that they were paying top dollar for home care services, and they had the finances to be able to afford private nursing care, which is it's a higher dollar amount per hour when you're providing care from an RN versus a CNA or an HHA. And then we looked at our established relationships, looking at our referral sources, saying, do we have good relationships already where they can look to us and say, oh, okay, I have a wound care case for you, or I have, a post-operative case where I feel comfortable and I feel confident referring this to your agency, given the relationship we have and how you've handled previous referrals in the past from our home care side. So really analyzing the marketplace and our referral sources from that end to see if we even had an opportunity to do so. Um, and I think we are in a unique place, being the fact that a lot of the payer sources here are private pay versus CMS. Just given that we are in a more affluent area and people can afford out of pocket care. After that, we wanted to look at our leadership too. So who is going to lead the charge on this? I'm the visionary, but I have no clinical background in terms of I'm not an RN or an MD. So the first thing I wanted to do was hire a director of nursing who can help me identify how we're going to create these clinical workflows, how we're going to create, from an operational perspective, how we're going to create the infrastructure to even be able to provide private nursing care. So those were my first, two things I wanted to think about. And then once I was able to find, it just so happened, our director of nursing who works with us now, she used to be a caregiver 10 years ago for us. She went and got her RN. She had a ton of experience working in med surg, and she worked kind of all over and was looking for the next step as a leader in her clinical experience. And it just so happened it was the kind of the perfect storm where we were able to bring her on at the right time. And that's when we wanted to look into having a consulting agency to work with and integrate with, because I didn't feel super comfortable coming up with our own policies and procedures and that infrastructure on our own. I think I needed someone to help me create that was a trusted partner that had that clinical experience and had the infrastructure experience to create the proper policies and procedures and workflows for an agency to succeed, and specifically private pay agencies, which has been, it's hard. It's a very niche business to be in of like private pay consulting, but we were able to find the business of senior care. You guys have had a lot of experience working with other Always Best Care agencies and working specifically with private pay nursing. So that's where we came in and started to, get in talks with Lucas and our consultant Joe. So
Yeah. Awesome. I, couple questions that just lead me to is like if someone for you guys, and then if somebody's considering it, it is based on what the licensing is in the state, but then
yes.
it's also based off of like what you want to provide. How did you make decisions around the guardrails of, where the current home care agency line of scope, the scope of services stop, and then what you can do from a medical perspective in terms of nursing care, what you wanted to do, and then how far you wanted to go. Like how did you make some decisions on the guardrails for what your service line would be?
I think a huge part of that is market analysis. Look into the other competitive agencies, see what services they're providing, and see where the need is. Because every territory in the US, there's going to be a different kind of comorbidity that they're dealing with. For example, Boston, for some reason, we've had a lot of requests for wound care. Like, I think that has been kind of our niche. And we've done competitive analysis for other agencies and seen that, okay, here are some, subsectors of care that are really popular and what they seem to be providing mainly. So looking at kind of from a competitive view of what are your other competitors offering, where are they seeing the most, revenue come out of, whether that's wound care, whether that's post-operative support, whether that's medication management and administration. And then from a compliance perspective too, we're in an unlicensed state. However, we want to be in compliance as much as we can in the assumption that we do become licensed soon. So we're adapting our policies and procedures off of the Briggs manual and trying to stay as compliant as we can, even though there's not a lot of guardrails already. It's kind of a gray area of what we can and can't provide, but we have that infrastructure given the manual. So we're basing it a little bit off of how like a Medicare agency would work in terms of what they can provide. But with that being said, we're not really providing super, super skilled care. If someone has, if we have a very high acuity patient, maybe they're vented or they're trached and they're, super super high acuity, we don't want to get involved because that's just more risk for us. So we want to make sure that this patient has a baseline stability level where they can age in place comfortably and we can come and provide them that services and help them recover. If it's a situation that is too much for home care and they may need to be in a hospital or a skilled nursing facility, that's where kind of our clinical operations and our director of nursing will come in and make that assessment. So making sure that we're offering baseline strong care, but we're not getting ourselves in too deep of what we can't handle. So we have said no to many cases, and we will continue to say no to stay compliant, to stay safe. Our priority is the patient safety, number one. And I think as long as we continue to lead with that testimony of patient safety first, we'll be in a good place. So I think number one, competitive analysis, see what your competitors are offering, see what the need is with your territory. If there's a lot of elderly people in your area, there's going to be a lot of chronic disease, congestive heart failure. There's going to be a lot of diabetes, kind of these chronic conditions that need to be managed at home effectively by NRN. And then second off to compliance level, what can your state in terms of rules and regulations, what can and cannot provide, and just staying in compliance is huge for what we can offer for our services.
Great, that's great to hear. The one other question I was thinking that may be difficult is the pricing component.
Hmm.
And there's two worlds. There's non-medical home care, which is typically the pricing is based off of shift and a dollar amount per hour, and then in a home health agency, it's oftentimes based on the visit. So it's
Hmm.
not a specific hour or time frame, but rather a visit to accomplish a set of tasks. And we're kind of in this middle ground here in private nursing. So coming from those two lenses, those two frames, how did you consider like structuring your pricing for this kind of unique service line?
Yeah. I think, similar to And I didn't mention this in the last response, but always if they're being followed by a Medicare agency, a VNA, they will always take precedence on the patient's care, and we're just there to supplement since we are private pay and we are in an unlicensed state. With that being said, I know those agencies are really focused on like length of stay, and I think it's like a 30-day window for Medicare or a 45-day window. And they're focused on goal setting and how can the patient recover to back to their baseline within this approved length of stay. Um, we are also focused on goal setting and making sure the patient's recovering, but we're focused more in terms of a pricing model, less on hours and more on the service provided. If it's more of a skilled service we are providing, wound care, um, post-operative support, something where we need to be heavily involved, we're going to price that at a higher level, especially if there's more risk involved too. If it is something as simple as filling a med planner, that's going to be a little bit less. But still, given the fact that it's provided by an RN, we have to charge a premium. And you have to look at too, and I can get into this in terms of recruitment strategies for nurses. You have to see what the nurses are getting paid at for their hospitals. And we want to be able to pay our nurses well enough. So, in order to pay our nurses a good amount that's comparable to what they're making in the hospital, if not more, to encourage them to pick up shifts with us, we need to be billing the client a certain amount in order to pay our nurses. So, I think level of skill that's required, and also just in terms of like nurse recruitment and retentive strategies, we got to bill a certain amount to in order to obviously gain revenue and to be able to pay our nurses well enough.
That's fair. And I think you brought up some really good points in terms of if you're trying to find high quality nurses for your
Hmm.
program, offering what, how can your agency be different if they're coming from a hospital or something like that, and home based care and traveling to see patients and things like that. Kind of a couple questions there. First one is key nursing leadership. What do you
Hmm.
think is important in identifying that director to oversee the care, and then after that, what do you think in trying to find high quality nurses to provide this type of care? What have you found that's been helpful for that?
Hmm. I think in terms of the last line of defense, I wanted to make sure that our director of nursing, I felt really confident with, if there's any sort of issues in the field, any sort of troubleshooting, our director of nursing is going to have the last say of, okay, here's what you need to do, from like a care direction standpoint, and here's, a client that we maybe need to discharge or say no to or say yes to. So they're going to have that kind of final clinical decision making. So with that being said, they need to be really sound clinically, and that's why we hired Bianca. She has that really strong clinical support and that knowledge to be able to make those decisions on a patient's care. And they need to also look into all the different factors. What other agencies is this patient working with? Are they with PT? Are they with the VNA? Um, are they with OT or speech? And try to take in all of these different moving parts when you're aging in place and when you're receiving care at home, and being able to look at it from a holistic lens in terms of how are we going to recover this patient? How are we going to get them to reach their goals in terms of care, and acknowledge all the other moving parts that come along in the care continuum for a patient. So someone that can look at that, and then and be a leader for the nurses and be able to essentially communicate a care plan, create the care plan. So our director of nursing is the one doing these initial intakes, assessing the patient, assessing their medical history, communicating as a liaison between the discharge planner at the hospital or the SNF, and then coming up with a care plan. They need to be able to not only create that care plan, but appropriately communicate that to the nurse and make sure that they are coherent and they're understanding of what their expectations are in the field. And that requires a really good leader, but that also requires really sound nurses. And a huge proponent of that has been hiring nurses with strong critical care experience. So either med surge or ICU critical care. They need to have a couple years on the floor to work with us, because when you think about it, when you're working on a medical surgical floor or ICU, you are dealing with all different types of disease states. You're dealing with all different types of patients. On any given day, you can have a patient dealing with like a brain bleed, and then the next patient could have kidney failure. And they see so many different types of clinical states. So it makes them very well rounded clinically and really sound. And
Yeah.
we're not going to be dealing with super high acuity patients in the home setting, at least for now. So this is a walk in the park for them. And normally their ratios are pretty high. They for any given floor, they could have at least maybe 5, 6, 7 patients they have to take care of, which is a lot during a shift. And I think a huge selling point for us is when we're talking with nurses. Sometimes there's when you say home health, home nursing, they sometimes are like, what? Like, I don't feel comfortable providing care at home. And you have to explain, listen, it's a 1-to-1 patient ratio. You are always supported by our director of nursing, by our director of client services, by myself, by other nurses. You're never fully alone. And you're not worrying about having to take care of like 6 other patients in a given shift. And usually it's shorter shifts. And yeah, I think that's been a huge uh, bonus point when we're explaining kind of the difference between like home nursing versus taking a per diem assignment at a hospital. So,
Awesome. Um, what do you think? What are some things that you maybe didn't expect in working through this program that were different, or just weren't like, oh, I didn't really consider that that was going to be a part of this, or just something that was unique?
yeah, I mean, I think that's a really great question. I think just all the work that has gone into building out the infrastructure and having to kind of make decisions based off of being already in a gray area when it comes to rules and regulations and really just trying to take the higher road of being ultra compliant in what we can and can't offer. And that means I didn't expect saying no this early on so quickly to so many things. But I'm focused on long-term goals here, and sometimes you're going to have to say no a lot in the beginning, maybe to a client, to like an opportunity, in order to provide the best care possible and to provide the safest, scenario for the patient and to build that trusted, resource with your referral partner as well. So I thought this was going to be something as easy. Home care is it's way more simple. Private nursing, there's a lot of gray area. There's a lot of compliance and risk. So I didn't expect it to be this, you know, I didn't expect to say no to this many things as quickly and just having to be super, super regulatory in terms of what we can and can't do. But it's all for the greater vision and all for, once again, like our priority of just keeping people safe, which I'm okay with doing. Absolutely.
Absolutely, absolutely. The last sort of question that I was thinking is for our audience, if they're looking to start in an agency that has private nursing, or they're an existing agency looking to expand their service line. What would you tell them in terms of uh, the process, or in terms of if they were thinking about it, what would be the things that you would relay, that the messaging for them if they're kind of in this space and thinking about this?
Yeah, I would just have them really take a deep look into their environment, and if whether they're an existing home care agency that's looking to add a service line or they're brand new, take note of where you're located. Take note of what are the payer sources predominantly in your area. Are you around a lot of people that are on frail elder waiver? Are you a lot of people that are using Medicare, CMS? Or is it a lot of private pay? Is it more of an affluent area? Taking note of that is going to be huge to see if it's even um, worth the time and the resources and the money to open up a private nursing agency. So looking at kind of your landscape from a payer model perspective of who's going to be able to afford this care, and who's going to be using or collaborating with government programs such as Medicare, Medicaid. Look at, established relationships with your referral sources. Do you have any already, or do you need to grow them? I think trust is a huge thing in this agency, in this industry, and people, whether they're coming from a nursing home or a hospital or another agency, they want to trust that when they are sending you a referral for a patient, whether that's home care or nursing, they want to trust that you are doing everything in your power to keep this patient at home and to keep them safe and healthy and happy. And that is a huge thing to build. It takes years and years to build that relationship. So I would really focus on who are my existing referral sources, or where can I generate referral sources, and how can I build this trust as a nursing provider for these hospitals, these nursing homes, these other agencies. And just look into more of your client population in your area. What are their at-home nursing needs? Look into some market research of, is it a lot of chronic disease management? Is it a lot of elective surgery? Are mobile IVs super popular where you live? There's so many new with the advancement of healthcare technology and remote patient monitoring and everything being able to be done in a care perspective from home. Look into that and really zone into those trends and try to see if you can capitalize on that. Um, I know, for example, like in our area too, like I've seen some mobile IVs, I've seen mobile ketamine clinics come up because that's been a huge trend. And there's been a lot of research the past 3 years that have come out supporting these new lines of care. So really try to hone in on that and do a lot of research into your market and clinical research as well. And that will always benefit you.
Okay, nice. Thank you. And then last, I just want to say congratulations to you on taking this vision for private nursing and doing all the work, doing all the laborious work and hours to get it to into action, like putting it into action. That has to feel pretty good to have this program up and running and ready for patients.
Thank you so much. And it couldn't be done without the support from your team. And once again, my last piece of advice is just use your resources, whether that's a consultant or other peers in the industry, whoever it may be. Like, I think we've only gotten this far because we've really utilized our resources to the best of our advantage, knowing that we can't do it on our own. So it takes a village. So thank you, Lucas, for all the support you guys have provided so far. We're really excited.
Yeah, that is very exciting. Very exciting. Well, that's probably our time for today. I want to thank you. This is Monique Robinson. I'm the president of Always Best Care Private Nursing in the Greater Boston area. Thank you very much for joining us today.
Thank you so much.
All right, bye-bye.
If you found this conversation valuable, please leave a review on your favorite podcast platform. Also, be sure to like, comment, and subscribe to our YouTube channel, The Business of Senior Care. We'll see you next time on Home Care. Doors open.